simple oral hygiene could be a life-saving tool in hospitals, a groundbreaking study has revealed that a remarkably simple intervention daily toothbrushing can drastically reduce the risk of a patient developing pneumonia during a hospital stay. The findings, presented at the ESCMID Global Congress in Munich, suggest that improving oral hygiene could become a vital, low-cost strategy for preventing one of the most dangerous healthcare-associated infections. The connection between mouth and lungs, while it may seem counterintuitive, the mouth and the lungs are deeply interconnected. When a person is hospitalized, their oral microbiome, the community of bacteria living in the mouth, often changes. These bacteria can be inhaled into the lungs in the form of tiny droplets, potentially triggering infection. This is particularly dangerous because hospital-acquired pneumonia, HAP, is a leading cause of death in clinical settings. It is linked to longer hospital stays, significantly higher healthcare costs, increased mortality rates. While doctors have long known that patients on ventilators are at high risk, this study focuses on a more elusive problem: why many patients not on ventilators still develop pneumonia within 48 hours of admission. The HAPPEN study, a massive trial to find answers, researcher Brett Mitchell from Avondale University led the hospital-acquired pneumonia prevention HAPPEN study. This year-long randomized controlled trial involved 8,870 patients across 3 Australian hospitals. The researchers implemented a multi-layered approach to see if better oral care changed health outcomes. Direct provision. Patients were given toothbrushes and toothpaste. To assist those with limited mobility, the brushes featured specialized handles designed for easier use. Clear messaging. The brushes were explicitly labeled with encouraging messages like "brush away pneumonia" to remind patients of the purpose. Education. Patients were provided with QR codes linking to educational resources, and nurses received specialized training to encourage and assist patients with their oral hygiene routines. Dramatic results. The results of the trial were striking. Before the intervention, only about 16% of patients were brushing their teeth daily. Once the program was implemented, that number jumped to over 61%, with patients brushing an average of 1.5 times per day. This shift in behavior led to a significant clinical impact. The incidence of non-ventilator-associated pneumonia dropped from 1 case per 100 admission days in the control group to just 0.41 in the intervention group, a reduction of roughly 60%. Why this matters for healthcare. The significance of this study lies in its simplicity. Unlike expensive new drugs or complex medical technologies, the solution here involves basic tools: a toothbrush, toothpaste, and a bit of guidance. As Michael Klompas from Harvard University noted, the study is particularly valuable because rigorous data on preventing HAP is often scarce. The HAPPEN study provides a clear, evidence-based roadmap for hospitals to protect their most vulnerable patients through a routine that is often overlooked in standard clinical care. Conclusion: by integrating oral hygiene into standard hospital care, medical facilities can significantly lower pneumonia rates and improve patient survival. This study proves that sometimes the most effective medical interventions are the simplest ones.